thought I'd end our conversation today on a topic of vaccine distribution. I think it's just interesting. It's kind of the end of the end of the process of developing a drug. You have it out there, you're selling it, and you're trying to get it to the people who need it. There was a review article that I read. I'll just say the title real quick, called "A Review of Challenges and Opportunities in Vaccine Logistics in Low Resource Settings." And I don't know if you necessarily need to read the whole thing to get the gist of it, but they were identifying some new things that are more easy to access now. One was solar powered refrigerators that perhaps have some of the new battery technology in them that allow for portable transportation of vaccines. Drone delivery was another one.
Yeah.
I think AI was brought up as another way to more efficiently deliver and distribute. A lot of vaccines are lost due to cold chain failures. And I thought I'd throw the ball in your court once again to hear your thoughts on that as an executive in the space that, will be providing product at some point that will follow along these supply chains.
It's an excellent article, and it addresses parts of Africa. It's authored by a scientist out of Guyana, so they have firsthand experience. All
Mm,
of those challenges are much easier articulated than addressed in the real
mm,
world. I mean, it's very difficult, as we well know. But clearly, cold chain supply, the requirement, for instance, of mRNA, of the extreme refrigerant frozen state, minus 80 degrees Fahrenheit, et cetera, initially, and all of those types of things are real challenges. That's why platforms such as NVA that can be freeze dried or lyophilized become so important. I frequently comment on that a vaccine, in fact, any product you have out there, a therapeutic, is only as good as its ability to be administered and then actually utilized among the populations at the greatest need. And frequently, we don't see that in the real world, and that's the challenge. And that's where the people in the southern hemisphere have been challenged for decades in this regard. They did not receive the vaccines that they were requesting and needed for during the pandemic. They've been challenged with mpox. I mean, it just goes on and on. And so you've got all of those elements, and in delivering it is one thing. That's where drones and other technologies, developing it and being able to do that is where AI come in. But I think that's on the early stage. I'm
mm,
focused on the fact that what we want to be able to do is develop vaccines that we can assure that those that need them can receive them and have them administered. And that means in a freeze-dried manner. You want to do single dose if at all possible. That becomes important. MVA is traditionally a two-dose regimen. Obviously, there are challenges there, or it would have been resolved. And again, we urge people to pay attention to what we'll be participating in and presenting in next spring at the World Vaccine Congress in DC in that regard. So there are a number of things one has to do. Delivery of vaccines into villages now by drones is a great concept. It has a lot of challenges for true implementation, but that does not mean that it should not be pursued. There's not a manufacturing facility in Africa, on the African continent, that does MVA,
mm.
that can deliver product for them. There's not one in the United States. So we need to resolve those types of things. And GeoVax is working right there at the forefront of doing that.
All right. Well, David, thank you for the rundown on that. I really appreciated talking to you again. And for all our viewers, we had the CEO of GeoVax, David Dodd, with us, ticker symbol GOVX.